Welcome back to the Best PT Podcast. This is episode 3.18, talking about pediatric neuromuscular pathologies. The first pathology is arthrogryposis multiplex congenita, or AMC. The cause is a non-progressive neuromuscular disorder occurring in the first 3 months in utero. Signs and symptoms include cylinder-shaped extremities with minimal muscular definition, significant contractures, joint dislocation, and muscle wasting. Treatment here should focus on attaining maximal development through therapeutic positioning, strengthening, stretching, splinting, and the use of assistive devices. Cerebral palsy is a non-progressive brain damage disorder acquired in utero, during birth, or early infancy due to a lack of oxygen, maternal infection, drug and alcohol abuse, or prematurity. Signs and symptoms include abnormal muscle tone, impaired movement modulation ability, abnormal reflexes, impaired mobility. Patients with cerebral palsy can present with monoplegic, diplegic, hemiplegic, or quadriplegic symptoms. Two different subtypes of cerebral palsy, spastic cerebral palsy, results after a motor cortex lesion causing upper motor neuron disease and spasticity. And then athetoid or dyskinetic cerebral palsy results in basal ganglia lesions causing fluctuations between hypotonia and hypertonia. Treatment includes lifelong intervention to normalize tone, stretch, strengthen, and therapeutic positioning to achieve developmental milestones, as well as splinting, assistive technology, and possibly surgery to reduce spasticity. Down syndrome is caused by a genetic abnormality resulting in an excessive chromosome 21, also called trisomy 21. Signs and symptoms include hypotonia, joint hypermobility, flat feet, scoliosis, congenital heart disease, and vision and/or hearing loss. Treatment should focus on exercise and fitness, joint stability, respiratory therapy, and medical management of cardiac abnormalities. Duchenne's muscular dystrophy, one of the types of muscular dystrophy. Remember, there are many types, but this is just one of them. Duchenne's is a progressive neuromuscular disorder caused by the absence of the gene that makes the muscle proteins dystrophin and nebulin that causes a weakness in muscle cell membranes, myofibril destruction, and a lack of muscle contractility. As muscle is destroyed, it's replaced by fat and connective tissue in a condition called pseudohypertrophy. Death often occurs prior to age 25 due to cardiopulmonary failure. And remember, only males express Duchenne's muscular dystrophy. Signs and symptoms include progressive weakness, the inability to run, frequent falling, toe walking, hyperlordosis, pseudohypertrophy of muscles, especially the calves. Treatment should focus on submaximal exercise. Remember, these patients, if they're pushed too far, their muscles will be destroyed and replaced by fat and connective tissue. Treatment should also include respiratory therapy, splinting, orthotics, and adaptive technologies. Prader-Willi syndrome is a genetic condition resulting in partial deletion of chromosome 15. Signs and symptoms include small hands, feet, and sexual organs, as well as hypotonia, almond-shaped eyes, obesity, and a constant desire to eat food. They also present with coordination and cognitive impairments. Treatment should focus on postural control, strength training, and gross and fine motor training. Spina bifida is caused by an insufficient closure of the neural tube by 4 weeks in utero. We have spina bifida occulta, which is a non-fusion of the spinous processes of a vertebrae, but the spinal cord and meninges remain intact, so there is often no disability. Spina bifida cystica results in a cyst-like protrusion of the spinal cord through the non-fused vertebrae. Two types of spina bifida cystica: meningocele, where the spinal cord remains within its canal, and myelomeningocele, which is the most severe form of spina bifida, resulting in meningeal herniation, cerebral spinal fluid and spinal cord extend through the vertebrae in a cyst-like sac that may or may not be covered by the skin. Signs and symptoms include motor loss below the level of the cyst protrusion, sensory impairments, hydrocephalus, and Arnold-Chiari type 2 malformations, which are cerebral and brainstem tissue dislodging into the foramen magnum. Signs and symptoms also include osteoporosis, clubfoot, scoliosis, tethered cord syndrome, latex allergies, bowel and bladder dysfunctions. Treatment should focus on therapeutic positioning to reach developmental milestones, caregiver education on handling, range of motion, therapeutic exercise, skin care and wound care, adaptive equipment, orthotics, and wheelchair prescription. The last pathology in pediatric neuromuscular development is spinal muscular atrophy, or SMA. The cause is a progressive degeneration of anterior horn cells due to a mutation of chromosome 5. 3 subtypes of spinal muscular atrophy: acute infantile, type 1 or Wernicke-Hoffmann disease, occurs between birth and 2 months with life expectancy less than 1 year. Chronic childhood spinal muscular atrophy, type 2 or chronic Wernicke-Hoffmann disease, presents between the ages of 6 and 12 months with a slower progression. Children may survive into adulthood. And then juvenile spinal muscular atrophy, type 3 or Kuckelberg-Wieslander disease, presents between the ages of 4 and 17 years old. These children usually survive well into adulthood. Signs and symptoms include progressive muscular weakness and atrophy, diminished or absent deep tendon reflexes, and end-stage respiratory compromise. Treatment should focus on therapeutic positioning to reach developmental milestones, placing the child in a vestibular and visually stimulating environment, as well as the prescription of assistive devices and adaptive equipment. Something new that has just come out is a drug called Spinraza. It's the first FDA-approved drug, approved in December 2016 and approved June 1st, 2017 in the European Union. It halts spinal muscular atrophy progression in all types and restores motor function in type 1 infants. So this may be something you'll be seeing very soon clinically. That's it for episode 3.18, talking about pediatric neuromuscular pathology. The next episode is 3.19, the education of children with disabilities in America. This will be the last episode of the neuromuscular system. As always, the outline will be in the show notes. Thanks for joining me.